Happy Tuesday, it's me, Myra. Welcome to another anatomy lesson. If you'll go back and look at last week, you'll see that we learned about the femur. The week before that, we discussed the hip and the pelvis. So we're going to move on down inferiorly to the knee. We're going to cover a little bit of the femur, distal femur, as well as the proximal tibia. Okay, let's get started. So the knee consists of the distal femur joining the proximal tibia. We're going to go over the tibia and fibula next week. That's the lower leg. We're dealing with the distal part of the thigh joining the upper part, proximal part of the tib fin. Let me show you what I'm talking about here. This is a sagittal or lateral view. This is the distal femur superimposed. This is a set of side view. This is the tibia. Fibula is over here. This is the kneecap, also known medically as the patella. To give you another perspective, let me get a AP or a frontal view of that. Let me find it real quick. My apologies. Here we are. So this is the patella shadow here. This is the distal femur, epicondyles and condyles. We discussed those last week. Go back and look. This is the tibia here, the fibula, the proximal part. There is more that go down to join the ankle and also the foot. Okay, so this is the knee. This is the knee joint here. Right there, we're going to go over the tibia more next week as well as the fibula. But just know that the distal fibula and the proximal tibia, fibula, make up the knee. So once again, here is our sagittal view or our lateral view here. Our AP view here. Anterior, posterior. Lateral there. So the chief complaints mostly to the knee besides trauma, car accidents, falls, can be ligament related or bone related, fractures, that sort of thing. Let's dive in a little bit about knee pain, okay? Knee pain is a common complaint that affects people of all ages. Knee pain may be a result of an injury, such as a ruptured ligament or torn cartilage. Medical conditions include arthritis, gout, infections, can also cause knee pain. Many types of minor knee pain respond well to self-care measures like physical therapy, knee braces can also relieve the pain. In some cases, however, your knee may need to require surgical repair. Okay? What are the symptoms? Let's see what the symptoms are of knee pain. Let's get down to it. Swelling and stiffness, redness and warmth to touch, weakness or instability, popping or crunching noises, inability to fully straighten the knee. When should you see a doctor? You can't bear weight on your knee or feel as if your knee is unstable. You can't bear weight, or if you do bear weight, you feel like it's not going to hold you up, or it gives out. Had marked knee swelling, unable to fully extend or flex your knee. You have an obvious deformity in your knee. It's not looking like it's supposed to, like it normally does for you. You have a fever in addition to redness, pain, and swelling in your knee, or you've had severe pain that is associated with an injury, car accident, fall, something like that. Those are injuries. Knee pain can be caused by injuries, mechanical problems, type of arthritis, and other problems. One injury we see a lot in sports players, ACL injuries, torn meniscus. A knee injury can affect any of the ligaments, tendons, or fluid-filled sacs called bursa that surround your knee joint, as well as the bones, cartilage, and ligaments that form the joint itself. Some of the more common knee injuries include an ACL injury. An ACL injury is a tear of the anterior cruciate ligament, one of the 4 ligaments that connect your shin bone to your thigh bone. So it connects your femur to your tibia, correct? An ACL injury is particularly common in people who play basketball, soccer, or other sports that require sudden changes in direction, okay? Torn meniscus. The meniscus is the tough, rubbery cartilage that acts as a shock absorber between your shin bone and your thigh bone. Once again, between your femur and your tibia. It can be torn if you suddenly twist your knee as you're bearing weight on it. Knee bursitis. Some knee injuries cause inflammation in the bursa, the small sacs of fluid that cushion the outside of your knee joint so that tendons and ligaments glide smoothly over the joint. Patellar tendinitis. So patellar means the patella, the knee cap, correct? Tendinitis causes irritation and inflammation of one or more of your tendons. The thick, fibrous tissue that attaches muscles to the bone. This inflammation can happen when there's an injury to the patellar tendon, which runs from the kneecap, patella, to the shin bone that allows you to kick, run, and jump. Runners, skiers, cyclists, and those involved in jumping sports and activities may develop patellar tendinitis. How about mechanical problems? Some examples of mechanical problems that can cause knee pain include loose body. Sometimes injury or degeneration of the bone or cartilage can cause a piece of bone or cartilage to break off and float in the joint space. This may not create any problems unless the loose body interferes with knee joint movement, in which case the effect is something like a pencil caught in a door hinge. Iliotibial band syndrome. This occurs when the tough band of tissue that extends from the outside of your hip to the outside of your knee, iliotibial, becomes so tight that it rubs against the outer portion of your thigh bone. Distance runners and cyclists especially are susceptible to iliotibial band syndrome. Hip or foot pain. If you have a hip or foot pain, you may change the way you walk to spare the painful joint, but this altered gait can place more stress on your knee joint, thus causing knee pain. Arthritis. There are more than 100 types of arthritis that exist. The varieties more likely to affect the knee include osteoarthritis, sometimes called degenerative arthritis. Osteoarthritis is the most common type of arthritis. It's a wear and tear condition that occurs when the cartilage in your knee deteriorates with use and age. Rheumatoid arthritis, the most debilitating form of arthritis. Rheumatoid arthritis is an autoimmune condition that can affect almost any joint in your body, including your knees. Although rheumatoid arthritis is a chronic disease, remember chronic means it's happened over time, not just suddenly, tends to vary in severity and may even come and go. Gout. This type of arthritis occurs when uric acid crystals build up in the joint. While gout most commonly affects the big toe, it can also occur in the knee. Pseudo-gout. Pseudo is a medical term meaning false. Okay? Pseudo-gout, often mistaken for gout. Pseudo-gout is caused by calcium-containing crystals that develop in the joint fluid. Knees are the most common joint affected by pseudo-gout. Septic arthritis. Sometimes your knee joint can become infected, leading to swelling, pain, redness. Septic arthritis often occurs with a fever, and there's usually no trauma before the onset of pain. Septic arthritis can quickly cause extensive damage to the knee cartilage. If you have knee pain with any of these symptoms of septic arthritis, see your doctor right away. Patellofemoral plain syndrome is a general term, like we said, that refers to pain arising between the kneecap and underlying thigh bone. It's common in athletes, once again, young adults, especially those whose kneecap doesn't track properly in its groove in older adults. They develop the condition as a result of arthritis of the kneecap. So, risk factors for any knee pain. A number of factors can increase your risk of having knee problems, including excessive weight. Being overweight or obese increases stress on your knee joints even during ordinary activities such as walking or going up or down stairs. It also puts you at increased risk for osteoarthritis by accelerating the breakdown of joint cartilage. Lack of muscle, flexibility, or strength. A lack of strength and flexibility can increase the risk of knee injuries. Strong muscles help stabilize and protect your joints, and muscle flexibility can help you achieve full range of motion. Certain sports or occupations. Some sports put greater stress on your knees than do others. Alpine skiing, with its rigid ski boots and potential for falls, basketball jumps and pivots, and the repeated pounding your knees that when you run or jog will increase your risk of knee injury. Jobs that require repetitive stress on the knees, such as construction or farming, also may increase your risk. Previous injury. Having a previous knee injury makes it more likely that you'll injure your knee again. An untreated knee injury, even a minor one, makes it more likely that you'll have similar injuries in the future. Prevention. Although it's not always possible to prevent knee pain, the following suggestions may help ward off injuries and joint deterioration. Keep extra pounds off, maintain a healthy weight, be in shape to play your sport. To prepare your muscles for the demands of sports participation, take time for conditioning. Practice perfectly. Make sure the technique and movement patterns you use in your sports or activities are the best they can be. Lessons from a professional can also be helpful. Get strong, stay flexible. Weak muscles are a leading cause of knee injuries. You'll benefit from building up your quadriceps and hamstrings, the muscles on the front and back of your thighs that help support your knees. Balance and stability training helps the muscles around your knees work together more effectively. And because tight muscles also contribute to injury, stretching is important. Try to include flexibility exercises in your workouts. Be smart about exercise. If you have osteoarthritis, chronic knee pain, or recurring injuries, you may need to change the way you exercise. Consider switching to swimming, water aerobics, or other low-impact activities at least a few days a week. Sometimes simply limiting high-impact activities will provide relief. Before we go, I would like to show you what a knee replacement, we talked about hip replacements week before last. So now let's talk about knee replacements. So when your joint gives out and your what's called bone on bone. So your femur is actually touching your tibia. It's not here, but just go with it. When the femur is touching the tibia and this space is gone, you may need to have what's called a total knee replacement. TNR. Sorry, total TKR. Total knee replacement. Total knee replacement. And that looks like this. This is the femur here. This is the tibia here. They remove the patella there on this particular thing. It is there though on the lateral, but you really can't see it here. What they do is they take and they drill and they put the replacement on the top and the bottom. Here's the side view, the sagittal view of the replacement on the tibia. This is the sagittal view of the replacement part on the femur, front view, tibia, femur. This is what a knee replacement, total knee replacement looks like. Real quick, I'm just going to show you before we go where the ACL, the PCL looks like, where they are. So here's the patella again, the kneecap, lateral collateral ligament right here. See, it's from the fibula to the femur. This is the fibula. This is the tibia right here, tibia. Medial meniscus, medial collateral, MCL, medial collateral meniscus. Here's the femur, okay? I have one more to show you. This is the lateral collateral ligament again. This is where all the ligaments and tendons are. Here, patella again, or the kneecap, the femur, medial meniscus, posterior PCL is back there. Medial meniscus, lateral meniscus, posterior meniscus. Once again, that's the fibula and the tibia. I hope you've enjoyed our lesson of the knee. And next week, once again, we'll be going over the tibia and the fibula from the knee joint down into the ankle. Have a good night. See you on the next lesson.